Hello anatomy friends, this is Dr. Alsip, and in this learning objective video we will be discussing the anterior cervical triangle and its 4 subdivisions, so triangles all the time. You will likely notice some overlap of this video with the dissection supplementary video on the anterior cervical triangle. This is on purpose, and overlap of concepts is a good thing, particularly if you are new to anatomy. So take these opportunities to really delve into these topics and review your knowledge when we have overlap. Alright, we're going to have 3 main goals for this video. The first is to diagram and hopefully draw out both literally and figuratively the anterior cervical triangle, so we want you to do this on yourself. We also want to map out the subdivisions of the anterior cervical triangle and understand what lies within the triangles. But we're going to start with this last one right here, this last bullet point. Why would we take anatomical structures and make arbitrary boundaries? Are we just doing this to make you memorize? The answer to this is of course not. Having agreed upon anatomical regions, in this case we are dividing into triangles, really allows for communication regarding location of structures, injuries, or pathologies. So, as part of a healthcare team, you could say there's a laceration in, say, the submental triangle, which is going to be right in this region here. So you could say there's a laceration in the submental triangle instead of having to say there's a laceration kind of close to the sternocleidomastoid but higher up and closer to the mandible than to the sternum. So being able to say something is within a triangle that everybody understands those boundaries will help with communication. Alright, so you can see here the borders of the anterior cervical triangle. Specifically, what we have outlined here is the left anterior cervical triangle, but we can also outline the right anterior cervical triangle, so follow along with me. And for some reason I'm having a hard time saying triangle, so excuse me. Alright, so the medial border is going to be the midline, and I'm just going to kind of follow along because there's going to only be one midline here. So the midline is the medial border. The lateral border is going to be the sternocleidomastoid muscle. So here is, I'm drawing the lateral border here. This is your sternocleidomastoid. I want everyone to kind of tilt your head to the side and look in the opposite direction and feel the side of your neck there. You are feeling the sternocleidomastoid muscle. It's that strong rope-like muscle which is a dominant structure in the neck. The superiormost border is the base of the mandible or the bottom of the mandible region. You can palpate this as well. So take a moment to locate these borders on yourself. Feel that midline, feel your sternocleidomastoid, and feel the base of your mandible. And this will really help understand the region we are discussing in the anterior neck region. The anterior cervical triangle can be further subdivided into 4 triangles. We will start our conversation with the most superior lateral one, the submandibular triangle, sometimes referred to as the digastric triangle. And you can see from the boundaries or the borders why it is sometimes called the digastric muscle, because both the anterior and posterior bellies of the digastric will form the inferior borders of the digastric or submandibular triangle. The superior border will be the mandible. It is referred to as the submandibular triangle as the major content is the submandibular gland, which we will see a better view of in the next image, as well as the facial artery and vein, and portions of the hypoglossal nerve or cranial nerve 12 are also located within this triangle. Moving medially, you will find the submental triangle, which is formed by the midline, so medially here, the anterior belly of the digastric, as well as the hyoid bone, which is right here. This is one of the smallest triangles, as you can appreciate in comparison to the other subdivisions. The mylohyoid muscle, one of the suprahyoid muscles, is located here, as well as submental lymph nodes and the superficial submandibular veins, which will coalesce in some individuals to form the anterior jugular vein, which you can see here. All right, moving to the more inferior subdivisions, we have the carotid triangle, which you can see here. Gotta love the carotid triangle. There is much going on. It is formed by the posterior belly of the digastric muscle, which is deep to the submandibular gland here, so you can't really see that posterior belly in this view. The sternocleidomastoid will be the lateral boundary, so here's your SCM here. And the superior belly of omohyoid will be the medial boundary. And like I mentioned before, there is a lot going on in the carotid triangle. The carotid sheath and its contents are located within. So this is going to be the common carotid artery. And a bit of the internal carotid artery. That's going to be the medial-most structure in the carotid sheath. The internal jugular vein will be the lateral-most structure. The vagus nerve will be deep and intermediate. You don't see it in this view because it is going to be deep. And then the ansa cervicalis, which innervates the infrahyoid muscles, is typically located either within the actual carotid sheath or superficial to the sheath. So you can see that ansa running right here. So that vagus nerve would be deep to the ansa cervicalis and larger, and that's how you're going to differentiate that one. The last subdivision is the muscular triangle, which you can see right here. And while, as the name would suggest, there are certainly muscles located within, most of the infrahyoid muscles or your strap muscles are going to be here. But some important viscera are located in the deeper portions of the triangle, such as the thyroid and parathyroid glands. And deep to that, you'll have the larynx and portions of the trachea and esophagus are also located within this triangle. The borders include the sternocleidomastoid inferolaterally, which you can see here. The superior lateral border will be the superior belly of omohyoid. So there is that one of those infrahyoid muscles. And medially, you'll have that trusty midline running right down here. So, that is the anterior cervical triangle and its 4 subdivisions. Please, please take some time to draw these out on your own. That act of writing or drawing will really help solidify your knowledge. It's much easier than just trying to memorize. So, let's try a question together. Alright, let's see how we do here. Injury within the carotid triangle could potentially affect which of the following structures? Is it the facial artery, the hypoglossal nerve or cranial nerve 12, sternothyroid muscle, submandibular gland, or the vagus nerve or cranial nerve cranial nerve 10? So pause the video if you need to think this through. Try to answer this without going back through the slides. Try to see where your knowledge is at. Alright, so hopefully you have settled on E, the vagus nerve or cranial nerve 10, as the correct answer. If not, please don't stress. Now you know this is an area you need to review, so that's kind of a win-win there. Recall that the vagus nerve is located intermediate and deep in the carotid triangle region. The facial artery is not correct. Portions of it are located in that submandibular triangle. And the same is true for the hypoglossal nerve. Both would be within that submandibular triangle region. The sternothyroid muscle is an infrahyoid muscle and would be located in the muscular triangle. And similar to that facial artery and hypoglossal nerve, the submandibular gland is located within the aptly named submandibular triangle. Alright, thank you for working through this question and potential answers with me. As always, please feel free to reach out with any questions. Have a great day.